Okay, looks like we're live. So hello everybody. Thank you so much for tuning in to our first live Q&A as part of our Understanding Cystic Fibrosis series. You can follow along with us and submit through Twitter using hashtag #UnderstandingCF, or you can comment on one of today's Facebook posts or any of the Facebook posts. We're going to be monitoring that for any of your questions during the broadcast. So today is all about providing some useful tips and information around traveling with CF, but ultimately if you are preparing for a trip and you are living with cystic fibrosis, just be sure to discuss everything with your own clinic team, as they'll know what's ultimately best for you. So I'd like to welcome our experts who are going to answer some of our questions today. We have Kate Gent, who is a nurse practitioner at St. Michael's Hospital in the adult CF clinic in Toronto, and Louise Taylor, who's a nurse practitioner with the Sick Kids Clinic. So Kate and Louise, thank you so much for joining us.
Thanks for asking us.
So it's right around March break for most of Canada. That's why we wanted to talk about this topic. Spring travel is definitely on the minds of many Canadians and probably in the plans for a lot of our people in the community. So why don't we start by asking how far in advance somebody with cystic fibrosis should plan for a trip, and what are some of the first steps they should take once they know they're going to be traveling?
The sooner the better, of course. Every time you make plans for a vacation, it's really important for you to sort of think through where you're going. And as soon as you know where you're going and booked, then it's probably easier to make plans for what you're going to do, how you're going to get yourself there safely, and how you're going to stay while you're there. So the sooner the better. And like you said, we want to make sure that you contact us as your clinic staff. And for us, it's easier to give us a quick email or a phone call, and we can get you some information that you might need about that place you're going, or what letters you're going to need, or whether you need to go and get some immunizations ahead of time. All those things are really important to think about well ahead, but we certainly understand short-term picking up a vacation when you can. So those are the kind of things that if you can do that, get in touch with us as soon as you can. We'll get you your travel letter and realize that we're kind of going crazy on our end too. So we can get those things sent to you in plenty of time for you to get on the plane with the right things.
And as Louise mentioned, it's important in case it's, depending on the country you're going to or where you're traveling to see a travel medicine clinic, because sometimes we do recommend seeing a travel medicine specialist, because they'll be able to actually look at where you're traveling to, and if there's certain vaccinations that are not your ordinary vaccinations that you might need, or if you need to be on malaria pills or other things. So we do recommend, especially in the adult clinic, for people that are traveling to all different places or going away to work or go to school, to see a travel medicine specialist. And sometimes there's a wait to get in there, and there's different immunizations that you have to take in advance at certain times.
Okay, great. So as soon as possible is probably best.
Exactly.
Okay, great. Knowing that everyone's case of cystic fibrosis is unique to them, some people manage CF-related diabetes, some use oxygen, some might have lower lung function. So these can all be a factor, I would assume, in planning for a trip. So what are some of the ways you advise those individuals to prepare in some of those cases?
So I think that's a good point about kind of all different forms of CF and different kind of complications. And I think for one thing, the importance is to after you've checked in with your CF team, and if you know how your lung function and how stable you are, that's one thing. So your lungs, we want to make sure you're safe to fly, and that if you do need oxygen, regularly, that you have enough oxygen and set up with the airline and everything. But the other two things that you touched on are important things, like if you have a G tube for extra feeds, that you take enough supplies with you, and that you have enough supply of like formula and things so you don't run out, depending on what country you're going to, and all this documented in your travel letter. And the other thing is for people with CF-related diabetes. This is more in our adult populated diabetes. It's important to make sure that you take the right supplies with you and enough to last you, and also how you store and manage the insulin, because insulin cannot be in really extreme heat or extreme cold temperatures. So important that you're kind of managing that appropriately.
Correct. A couple of things about just about the oxygen. You should never assume that you can get on a plane and use their oxygen. I know it comes from the sky, it falls down if you're in an emergency, but you just can't go ahead and ask the flight on a flight to use oxygen if you're short of breath. use oxygen at home, or if you just maybe use it on occasion, it's probably it is very important for you to call your team and make sure they make arrangements with the airline ahead of time. This is a lot of paperwork and a lot of signing, so it's very important because they may make you get off the plane if you're not well. And depending where you're going, be careful also, because places like Denver are very high cities. They have a lot of very high elevation, and it can be short of breath for people without being short of breath. So you really got to make sure that you know the place that you're going and whether there'll be risk to you.
Right. So really having to consider where you're going and what the conditions are going to be. Okay. So speaking of airline policies, sort of lines limit the amount of liquid you can bring in your carry-on, which, inconveniences all of us in different ways. But I imagine when it comes to medications, does this have an impact on medications that maybe somebody needs to have with them, and how should they prepare for that?
Well, it's really important that you get that travel letter and very clearly make sure that we know what you're taking with you, because if it's in the letter, and then we're very clear about saying these are liquids and they need to be carried on with this person in your carry-on, and make sure you do, because if you put it under the plane, a lot of these things will freeze, so that might make your medication ineffective, and you don't want to lose it with your luggage. So important that you get a letter from us, and that the airline security people don't take your medicine away right when you're about to get on the plane, because that is a big risk, especially now. It never used to be an issue, but definitely with the liquids. And what I tell a lot of the families, I see a lot of course, families that have little babies, and they take a spare antibiotic with them, so that in case they get sick, I say, please don't mix it. So they take away a little bottle of the powder, and then they get bottled water and mix it once they get to their destination if they need it. And you can ask your team for that too if there's other forms. Sometimes when the liquid medications can be switched over to a puffer, so those would be easier to use while you're away as well. So if you can ask your team if there's anything substitutions, or even puffers can go to a powder formulation, depends what you're on.
Okay, great. And so when it comes to medications that they need, the kind of preparation that you should do, so more than enough is best, I would assume.
Yes. And we always try to recommend, like, it's important to see your CF team pretty close to when you're leaving, and so you can have a proper assessment and find out if you need a new treatment or anything. But either way, if you have been known to be colonized with different organisms, or we know kind of what to treat you with, we always try to send people with a course of antibiotics. So we'll prescribe maybe a 2-week course of antibiotics depending on how long you're going for, to have on hand. So it's important to have that prescription from your CF team, but also fill it in Canada if you're traveling out of the country, so that you're not trying to fill a prescription that was written here, but to take the antibiotics with you, so that if you're unwell when you're away, all you need to do is connect with one of your CF team members, let us know, and then start taking the antibiotics so that we keep you healthy when you're away.
And make sure you know the precautions, because there's some very, very sun-sensitive antibiotics out there that will make you, if you start taking them, you'll burn. So we really are cautious, and we have heard a lot of really bad horror stories. People that have gone away and come back very burned because they didn't think we were maybe serious about it, or that it wasn't as bad as they thought.
Or they weren't aware as much.
And
I would say, most antibiotics, or the ones that we usually treat with, do have kind of a photosensitivity.
Right.
So we really recommend staying out of the sun, which is difficult if you're going to a sunny destination. And if you are in a sunny destination, wear a hat or like a high SPF, and really protect your skin.
For sure, in the water.
You can burn really easily.
Okay. Yeah, that's really good to know. And with medications, I guess, just ensure everything is labeled really clearly.
Well, that's the other piece. Yeah, make sure you carry at least one of the bottles that's got your name on it and what the drug is, because that's important. And sometimes you don't have that, because I realized when they give you enzymes, it's a whole bag of enzymes, one bottle, and you may have used that bottle already. So call the pharmacy, and our pharmacy will mail you just a sticker, so that you can just go ahead and put that sticker on one of your bottles.
Yeah. And all of this will be outlined in detail in the travel letter. So with the medications, the devices too for your physiotherapy or nebulized medications, it's all outlined. So that's why it's important to have a letter. But as Louise said, not many people have ever been asked for the letter. It's more of a safety precaution that if you did ever need to show it, you have it. Right. And it's easy for us to write for you.
Yeah, we have templates. It's nice, really nice if you just actually send us your list of medications, and then we can paste them and drop it in. Easier.
Perfect. So some individuals with CF require the use of equipment that has to plug in. So let's say you're going to Europe. Would a regular travel outlet converter make it so that you can use that there, or are there certain considerations to make if you're going somewhere that has different electricity requirements?
Yeah, so this is a tough question because, as you know, it's not really recommended for especially different kind of devices that, you know, need electricity. It can really, the voltage, you know, changes, and it really can actually wreck your machine.
Yeah.
Ideally,
Even with the converter.
yeah, you have
I know. Sometimes it just doesn't work as well as it should, and it just makes the motors run too fast and they get started. I've heard horror stories of these things starting on fire.
So I mean, Louise had a good point for those patients or those people that can switch to like a puffer form of different inhalers. You know, that would be ideal to be on a puffer form. And for some antibiotics now there are puffers if your insurance covers it. So those are always ideal to travel with. If you need to use a compressor for a nebulized medication, and you're in North America, there's a compressor that our respiratory therapist, Louise, was talking a lot about that works really well all across, you know, North America, the Perry Trek, and is actually more conducive to traveling. But if you're going outside of North America, and especially if you're going for more than a week, it's really recommended that you maybe purchase one in that other country so that you know it's working correctly. It's the safest, and you're not at risk of breaking your compressor tube.
And yeah, a lot of the families have family in other countries. They've come from other places, and they go there. They go to that place a lot. Then we say, look into getting a compressor while you're there, and just leave it at your family's home, so you don't have to lug equipment on planes. That's the easiest way if you're if you often go to the same place.
Yeah, right. But just talk to your CF team if you have specific questions about your compressor, your medications, because sometimes things can be tweaked a bit to change, or you know, if we want to keep you on the same therapies the whole time you're away, our respiratory therapists and physicians and physios and everyone can help kind of organize things before you go. Yeah.
Perfect. So is there anything to consider if you're going away to further countries, like let's say you're going halfway around the world versus just going away for a week in the States? Like, do longer periods of time away and further destinations make a difference in how you would prepare?
Yeah, I think that it's important if you're going away, especially when you have young people going to school or families. I have some families that go to their home country for many months in a row. It's important that you find a physician, maybe not that knows about CF as much as your own clinic would, but at least somebody who can see your child, yourself, and knows that at least sort of they can think about it if you became unwell.
Yeah, and there are many CF centers, you know, across the world. They may not be obviously in every city, but in each country there's connections to a CF center. And I think on the CF Canada website there is information about all the different
CF worldwide.
Yeah, CF worldwide, different centers. So we always try to connect patients to CF centers in other countries, especially if they're going away to school or to work for a longer period of time, so that they can still, you know, connect with them, go for like a visit or two, you know, if they need to, and have a connection with the CF team. But as Louise said, sometimes it's just important to be connected to someone medical. But if they have CF expertise, it's great. And I think, the longer, the more time we have to help prepare people that are going away for longer periods of time or really far away destinations is important, because connecting them to the resources and helping set them up with insurance, which we'll touch on after, and just having everything kind of organized and making sure they have enough supply of medications for that duration, because it's different if you're going away for a week or two. We give you a course of antibiotics, but we've had young adults that have gone all over the world for a year exchange or 6 months exchange, and so they might require a couple courses of medications to have on hand, plus enough like 6 months supply of all their standard of care meds.
And then probably a very important thing would be, if you're away for quite a while, come to your clinic right away after you come back. Make that appointment before you go. Come back as soon as you can, and make sure that you, as much as you may feel well, it's important for you to get your pulmonary function done and see the doctor fairly soon, because you just never know. And get your sputum set off, because you know other countries definitely involve different bacteria, so you want to be careful, cautious.
Yeah, and while you're away too, I always recommend, I mean, now with technology, it's so nice, like you can be connected to your CF center pretty easily. So it's always nice to have a connection, whether it's with your clinic nurse or, you know, someone.
I get a lot of emails.
I always try to go to my card as they're going to school or moving, because if they can just connect with me, I can connect them with the right people too from our team that can help address their needs. So I think that's important to have that connection with one of your CF team members. Definitely.
One of the biggest things we hear from our community, and we even got questions about it this week, is the challenge around getting travel insurance. So I know that might not be your area of expertise, but do you have any advice around how to go about getting insurance and making sure you're covered abroad?
Well, that's a tough question because, and like you said, there's no right answer. Every provider has a different policy, but I would certainly, if you have private insurance, touch base with them and find out what their travel policies are. They often will provide you with a small card, even if you don't have it. You can get it online and print it out. So those would be what you'd need to bring with you with important phone numbers on it. Always bring your own kept number with you if you're in Ontario. I'm not sure. Other provinces certainly, if you're listening in, bring your health card along with you. But also the most important thing to remember is you're not going to on vacation. We're assuming you're not going there to get a second opinion about your CF. So if something terrible happens while you're away, if you get a chest infection and need to be seen, it's the same thing as if you've broken your arm. You need to go to emergency and get emergency treatment, and that's where we need to sometimes when you come home make the argument to your insurance provider with a doctor's letter from us to say this was an emergency, they were not unwell when they left. I mean, this is the kind of things that become important if you have trouble when you're trying to claim that money back.
So it's just important, I guess, that your clinic team is part of that conversation. Kept in the loop.
Right. Okay. Sometimes there is like documentation that we can provide or that we need to provide to your insurance company. So having that conversation.
And if you don't have insurance, it's important that perhaps you look online, and there's lots of different carriers that you can just do short-term travel insurance. Some of them don't even ask if you have a chronic illness. Some of them will just be straightforward. You're paying this much. They look at your age. So you can do a lot of shopping around and probably find something that's not too horribly expensive. But I would recommend if you are a person with CF or have a child, don't go away without some sort of travel insurance. If you need to get home because you're unwell, your child is unwell, or you're unwell, if you need to get treatment, this can make you it can be financially devastating. It's very expensive out there.
For sure. Okay, so that covers a lot of the preparation for traveling.
Don't be so negative.
Better to, over prepare, it sounds like. So that covers that off, but then there's the part where you're actually in your destination. So during your trip, we know that those living with CF have very specific dietary and hydration needs. So what are some of your tips to ensure that they stay on top of their diet while they're away, their hydration? What would you recommend around that?
Most of the world doesn't have any trouble gaining weight on vacation. But it seems to me that sometimes our CF patients tend to eat a little bit less or not as frequently snacking because either you're in a hotel or you don't have the access to it. These all-inclusive places are probably the best. So we would recommend, certainly because you're probably going to be more active and you're running around in the water and doing a lot more activities, we hope, would be to go and certainly make sure those calories are the extra. The most important thing, and I always remind all the families, is the salt. Those hot countries, you have no idea how much extra salt you can lose. People with CF 10 times more than the rest of us. Even in the swimming pool, they may not feel hot, but when you pull those children out of the pool at the end of the night, if they're really listless, if they're quite lethargic, despite the fact it might just be that they're tired, make sure that you're getting in a lot of extra salt on with every meal. Things that are simple to do, like salt on the food, lots of pizza, French fries, Gatorade is in the hot environment.
Oh yeah, anything with like extra salt and just to stay so hydrated. In any country, but especially the hot countries.
Right. Yeah. Stay on top of that. Okay.
Yeah, and just to add to that too, and it kind of is in a preparation point too. But if you're someone that has maybe lower lung function or has a lot of trouble gaining and keeping your weight on, these are important things to discuss in the preparation and planning and talking to your CF team to make sure that you're safe to travel. From a health perspective, you feel that it's an okay time for you to travel. And sometimes you might make your decision either way, but I think having you really assess with your CF team is important too. Just because if you're away and you get sick, we don't want you losing any calories or lung function.
And if you have a G-tube, sometimes it's really inconvenient to take your pump along with you and all that formula. We really make a lot of deals with the young kids and say, this is what you're going to do every day. You're going to go to the milkshake bar and you're going to drink extra milkshakes. I mean, these all-inclusives it's impossible not to have enough food. But it's surprising to me how many children with CF come back having lost weight because they don't push those extra calories or those G2 feeds aren't gonna, we say, you know, for a week you're off your feed, but you need to make sure that those extra calories go in.
And the other option for G2 feeds is you can take, I've had a couple of my adult patients take, you know, all their feeds, but instead of taking the pump setup, just bringing sort of like large syringes.
Yeah,
and just syringe
exactly.
some extra feeds in some nights for extra calories, and they said that worked really well.
Okay.
Yeah.
Great. So traveling obviously presents lots of opportunities to do all kinds of really great things, interesting experiences, and given the time of year, we probably have a lot of people going away to those hotter destinations. Yeah. So what are some do's and don'ts with, like, are there limitations to things you can do when you're traveling abroad? You know, what would you say?
Well, the first thing is go away. I mean, that's almost universally when I see new families with new babies a lot. They all ask me, can we still travel? Can we go away? And it's the most important thing Kate and I want to make sure is that despite a lot of sort of rules and regulations, we really want you to take your children away, go away see the world. It's the most exciting thing to do. So the do's are to go away, but you want to be cautious while you're away. I mean, one thing, the only big don't I can think of is don't go scuba diving, because it's a very big risk for people that have lung disease that you can get a pneumothorax. And snorkeling, great. Yeah. Going down deep, and probably mountain climbing would be the other one. Don't go mountain. I mean, I don't know.
Well, I was going to say, like,
I don't know.
a lot of the things that with a lot of height and altitude, but the scuba diving too, but also just not to overdo it. Because I think, you know, anyone's really excited when they go on a trip, but especially the first few days, like, don't overdo it, and really, and be well balanced, because you don't want to go on a million hikes. You know,
if you're not a person that was active before, and then you're out there
right.
hiking for 10 miles, like, just take it easy.
So everything in moderation is good.
Right.
Eat as much as you want and can, but maybe, you know, with the exercise, we want you to exercise, but we don't want you to exercise too much where you're able to do it in your run down.
So no scuba diving, but definitely with everything else, just kind of gauge where you're at.
And we do, I mean, there's not a lot of science or evidence behind it, but we really do kind of warn people against hot tubs, because they do tend to be uncirculated. They're circulated, but not, and they have a lot of chlorine in them, but they also have a lot of Pseudomonas in them. So if you're at a beautiful resort, you could do all of the pools and everything else, but the hot tubs tend to stay away. They do aerosolize a lot of the water, and there's a lot of Pseudomonas in those. So the last thing we want you to do is come home with a new bug.
And hand hygiene is like number one. We just said that for second we were talking about hand hygiene, washing our hands, sanitizer, you know, at all aspects of traveling, like, you know, in the airport, on the plane, especially. That's the one main way you can. I saw questions that you might be asking about, but keeping your hands clean and sanitizer and like infection control is really important.
Yeah.
You know, and I always try to say, like, you know, infection control, and try to stay away from sick. If people are coughing, or really infectious seeming, you know, or like
they're beside you, it's a tough one on that plane.
On the plane, at least when you can control it, like in a hotel or traveling, to try to, you know, keep yourself the most.
You don't have to be in a bubble, but we do recommend just those common things that you probably do around the house and in your schools anyway. So
in the event that emergency does arise when you are away, what are the first steps to take? And you sort of touched on this a little bit earlier with the travel insurance.
Yeah, I guess it depends on the extent of the emergency and what it really entails. But definitely, like, if the insurance, that's why we recommend the insurance coverage, so that you could go to the emergency department and see somebody right away.
But if you've fallen and broken an arm or leg, go to an emergency ward. But if you have a chest exacerbation, or you're feeling sick, the first thing would probably be to start your antibiotic. And
call or email your CF
when we're around, not like when, depending on where you are and what the time is like. But give us contact. And because sometimes we hear families that go to emergency rooms and they end up with these big bills, and we would have said, you know, we could have probably done a lot of troubleshooting on the phone. So we want to make sure that you guys are not being charged for things. If we think you should go to the emergency room, we will tell you to do that, right?
Louise made a good point. If we're not available, or if it's like on a weekend or in the middle of the night, and you break a bone, or if you're really sick, you know, definitely seek the help right away.
Go to emergency.
Okay. And so when you do return home from the trip, is there anything you need to do when you come back?
Come see your CF team.
Tell us about your trip. Bring pictures.
Definitely check in with your CF team and try to have a visit. I always try with, like, our adults scheduling their first visit. When they're back that first week in clinic, if they're able to come.
But if all is well and everything,
Yeah.
everybody's happy and well, because hopefully you've gone on this wonderful warm vacation and you've come back healthier than you went.
And you have really high vitamin D levels.
Yeah, stay
sun.
home and enjoy and then let us know how it went when you're back. But there's no need to rush to see us, but definitely if you're unwell, it would be important to us.
Yeah.
Okay. And then we did get an audience question that was around, you sort of touched on it with the plane. I know you guys saw it. So Tammy on Facebook is looking for some recommendations on infection control practices while on an airplane. So she mentioned she brings Lysol wipes and, you know, she wipes everything down. Is there any reason to wear a mask on the plane? Like you say, that's a hard environment to control. So
the air is not circulated.
Yeah.
And you know what, masks last about 10 minutes. That is it. Now for a person to wear masks on a plane for longer, before you even take off, you'll be wanting to rip it right off. And the truth is, you're only getting about 10 minutes. As soon as they become the least bit damp, they are no longer protecting you. So I would say no to masks.
okay.
Yeah.
So just like the sanitizer.
Sanitizing and hygiene.
I like your Lysol thing,
Yeah,
though,
Lysol.
because I would
Wiping
wipe down that tray because they don't get cleaned very often. And certainly don't let your child go into that little pocket. There's people throw up in there sometimes. It's really not great. So I would just wipe down as much as you can. If you have somebody beside you, the hard part is that third person perhaps might be coughing and sneezing. You should ask perhaps to move your seat if that's possible.
And you know, traveling during flu season is tricky too. Of course, that's the nice time of year. Well, not nice here, but nice away.
Right.
Whatever
Everyone
goes
wants to
on.
go away.
But it is tricky because that's when maybe people are more at risk of getting sick. The flu vaccine is
Get
really
your vaccine.
important, and that's a good reason to kind of remind people to get a flu shot.
Before this.
Yeah, like that is an important kind of preventative measure to do too.
Yeah, it's the most important preventative thing we can do for the season, really.
Right. Yeah.
And
especially
there's
for airplane traveling.
Oh, there's so much flu out there right now. There's the hospitals are full of people with flu.
Yeah.
So
Yeah, so difficult one to control, but sort of do whatever you can to sanitize.
Yeah.
Okay. I don't think we have any questions from online. Sarah? No? Okay. All right. So I think
that everything.
Yeah, I think the biggest takeaway is definitely that travel is possible. It's encouraged. It's, you know, don't let it limit you at all from seeing the world. But it's important to take those precautions and definitely talk to your CF clinic before.
And there's lots of resources. I mean,
Louise has
this is on the CF Canada website.
This is right on.
We've been linking out to that document this week.
Yeah.
So if you just go to our Facebook or our Twitter, we've been sharing that. There's tons of travel tips in there. A lot of what we talked about.
We have our Toronto Adult CF website for those of you that know of it, or that those of you that don't. But you just Google Toronto CF Adult CF clinic, and you'll see that we have a whole section on traveling too. It's a lot of the same points as the CF Canada website.
Right. Okay, well, I think that does it for us. Thank you guys so much for joining us. And this will be online after we're done here. So watch, if you want to watch it, stay tuned.
Thank you.
Thanks.
Thank you. Bye, everyone.
Yeah. Happy travels.